So complex PTSD, there's a few things to know about it. It was only introduced, as I said, in 2018. So we're only just starting to see some really interesting research coming out on complex PTSD. But we often think about complex PTSD as a potential outcome where there has been very complex or early developmental trauma, that complex PTSD might be a particular outcome from that. But I think probably core to remember about it is that the fundamentals of complex PTSD are the same as standard quote unquote PTSD. So to have complex PTSD, you have to have PTSD. And then there are some other symptoms. So PTSD symptoms, when they come with significant emotional dysregulation, relationship difficulties, or negative self-affect, like I'm not worth anything, those clusters alongside PTSD would be called complex PTSD. So it's a relatively new diagnosis compared to standard or just PTSD, but the symptoms are very similar. PTSD is core of complex PTSD, and the treatments are also still the same. So it doesn't need to be treated as a completely separate mental health outcome. And that's really, really important when we're considering it as a possible outcome for young people.